Rare liver tumors. What makes diagnosis so difficult? Imagine trying to solve a puzzle where many pieces look alike and some pieces are missing. That's often what diagnosing rare liver tumors feels like. These tumors are uncommon, so doctors see them less often, which makes recognizing them a real challenge. Unlike more common liver cancers, these rare tumors often don't cause clear symptoms early on. Patients might feel perfectly fine or have vague signs like mild abdominal discomfort, which can be mistaken for less serious issues. Because symptoms are so nonspecific, doctors may not suspect a rare tumor right away. When doctors use imaging tests like ultrasounds, CT scans, or MRIs, they look for clues about what's growing in the liver. But here's the tricky part. Rare liver tumors often look very similar to more common tumors or benign lesions. They can have overlapping features, making it hard to tell them apart just by images. Sometimes, specific signs can hint at a rare tumor, but these are subtle and requiring highly experienced radiologists to spot. Since imaging alone isn't enough, doctors usually need a tissue sample, or biopsy, to make a definitive diagnosis. But biopsies can be complicated because of the tumor's location or the patient's health. Plus, some benign tumors can mimic malignant ones on scans, which adds to the confusion. This means that a careful, detailed examination of the tissue under a microscope is essential to identify exactly what type of tumor it is. Another challenge is that rare liver tumors include many different types, like fibrolamellar hepatocellular carcinoma, hepatic lymphoma, epithelioid hemangioendothelioma, angiosarcoma, and neuroendocrine tumors. Each has its own biological behavior and appearance, which makes diagnosis even more complex. Because these tumors are so rare, doctors have less experience with them, and there are fewer established guidelines to follow. This can sometimes lead to misdiagnosis or unnecessary treatments. To improve accuracy, doctors often use multiple tests, including different imaging methods, and sometimes repeat biopsies or advanced scans like PET scans. This process can take time and resources, but is important to avoid rushing into surgery or treatments without being sure of what's really happening. From a liver health and liver cancer perspective, these diagnostic hurdles highlight why early referral to specialized centers is so important. Experts can better interpret complex images, perform precise biopsies, and develop personalized treatment plans. It's crucial not to jump to surgery or treatments without clear evidence of what type of tumor is present. Accurate diagnosis helps ensure patients receive the most appropriate care and avoid unnecessary procedures. In summary, the rarity of these tumors, their vague symptoms, overlapping imaging features, and the need for detailed tissue analysis all make diagnosing rare liver tumors a real challenge. Staying aware of these difficulties and working with experienced medical teams can lead to better outcomes. Always remember to consult healthcare professionals for personalized advice, as each case can be quite different.